Welcome back, and we're still talking about workers, this time in the health sector. They've given the government a 2-week ultimatum, the federal government, over pending agreements. So it's one thing to sit at a negotiation table and say, okay, we're going to do this. It's another thing to see that this is done. So let's look at some of the things that they are concerned about. A review of their consolidated medical and salary scheme. That's the resident doctors, the Nigerian Association of Resident Doctors. They say their CONMAS review hasn't happened in 10 years. There are other conditions that they have also said have not been met, agreements that they've had with the federal government, including also decay in medical facilities across the country. That is a concern to them as well, and they're asking the government to do something. They are demanding an immediate increment in CONMAS structure, amongst other issues. Well, to speak on the doctors' demands, especially in the light of the May Day celebration, we have in the studio National President, Nigerian Association of Resident Doctors, who's also a Senior Registrar, Orthopedic and Trauma Surgery, Dr. Emeka Oji. Thank you for joining us.
Thank you.
So how did you celebrate May Day yesterday?
Well, I was mostly up and about from one studio to the other, trying to explain our stand on all the issues that you just read out, and use the medium to appeal to the government and the Nigerian people to understand what we are doing and seek for their help. And
it's that understanding that some will say it's not there, because a lot of people will say the doctors, I mean, the medical doctors are always asking. They are always demanding this or demanding that, and then threatening one strike or the other. Are they even concerned about providing the services that they took the oath to provide?
Incidentally, the current issue we are talking about is actually for the Nigerian people, because I'm sure they have been visiting our public hospitals. They have been seeing the increasing waiting time to see the doctors, cancellation of surgeries. In fact, some people come there and spend a day or two, they won't see that because the numbers are not there anymore. People are living in their numbers. And we have identified the major cause of this to be the terribly poor remuneration that we are getting in the health sector. You may have to know that the consolidated medical salary structure that you just talked about was approved in 2009. And part of the collective bargaining agreement we had with government then was that it to be reviewed every 5 years, and that has not been done up till now. So yes, it's not really about only about payment, but the fact is that this thing is leading to brain drain, and people are leaving. So what do you do to address it? You try to review the salary structure upwards. There is also this issue of dilapidation in infrastructure, and the lack of personnel. So generally, there is this call from our members for government to pay more attention to health by also improving the budgetary allocation to health, because it's only when they do this that they are going to have enough funds to take care of the manpower challenges, the infrastructural need, and of course the remuneration.
It's interesting you talk about remuneration, that the CONMAS structure, yes, was reviewed 10 years ago, and that since that time there's been no review. So usually the general increment, which happened sometime in 2019, didn't affect health workers?
Oh, that one is consequential adjustment of minimum wage. It didn't add much to it. And if we are talking about 2019, that is, if we are to go by that collective bargaining agreement, that review should have happened in 2014. And we are already in 2023. So ever since then, you've been having rising inflation rate, you've been having an increase in exchange rate, and general cost of living. So things are getting worse, but there's no increment in your take-home pay. So, and of course, there is nobody that will see that is no longer meeting up with the needs, and he has a better opportunity outside without, it's a natural instinct. The person will just decide to go outside there and take care of himself. It's a natural instinct.
I wanted our viewers to, be be helped to understand it? Because I know that usually when there is an increase in minimum wage, it's supposed to affect all workers. There will be a consequential adjustment across board. I know that the consequential adjustment as a result of the minimum wage was a very big issue, because people were saying, oh, if you're going to be increasing from 18,000 naira minimum wage to 30,000 naira, can you also do same for all the other salaries affected along that line? So I think it was a deal reached around, how I think percentages were applied of the minimum wage that was actually increased across board. So I was wondering if that also affected medical workers, or medical workers were exempt, because in recent times we've been hearing something around an increment in salaries, 40% increment, we understand, that should happen, or perhaps has happened, but that is not affecting ASU workers, and as a result of that, we could be seeing some complaints from there sometime soon. What is that conversation currently happening? I mean, around a 40% increment. Is it something that you think, if it happens, if it hasn't already happened, will it affect doctors?
It has actually happened, and the government has made it clear that doctors and health workers are not part of it. And even the consequential adjustments of minimum wage that you talked about affected us just slightly, and we still have a large number of our people who are still being owed the arrears, which is also part of the demands that our members are making in that communique that we released. So you see, the fact is that we don't just want government to increase the remuneration without taking into account the figures we talked about. Otherwise, we are not going to be able to address the problem. When people heard that we are demanding for 200% upward review, if you look at it literally, it may sound outrageous.
200%, that's what you're asking for.
Yes, if you look at it, it may sound outrageous, but we didn't just come up with that figure. We believe that any increment should be based on the inflation from 2009 till now. Okay, I'll give you an instance. The exchange rate then was 152 naira to $1. We know what it is today, up to 800. The fuel price then was 65 naira per liter. We know the amount today, and there is even an imminent increment that is coming on board. So just like yesterday, we even got to know that the minimum wage you talked about, when it was 18,000 naira, the equivalent in dollar was 91. But now that it is 30,000, the equivalent is for something. So this thing is not just about increment, but can you increase this in a way that the take-home pay of Nigerian doctors and indeed other health professionals will be good enough to make them stay in their country? And we are not just saying this because we know the country can afford it. All they need to do is to increase budgetary allocation. The percentage of our budget allocated to health for this year is 5.7. You cannot be able to meet up with that kind of allocation. They have not started obeying the Abuja Declaration, which we have been talking about since 2001, and because I'm almost sounding like a broken record, because anytime I appear on television, I say this because it's important. In 2001, Nigeria entered into an agreement that it will be allocating minimum of 15% to health.
Indeed.
So can we ask them, have they ever met up with that? The answer is no.
If we're looking at, because yes, some people say your demands are spot on, I mean, in terms of what you're asking for, and you have also tried to justify the reason you're making the demands in terms of looking at the inflation and its consequences. But some people will also say that what about the revenue of the country? Has it really gone in that trajectory? We've seen how we've struggled in recent times and how even the federal government has been borrowing, from what we understand in some instances, to pay salaries. Is it possible for us to now start saying, if indeed the federal government starts to allocate 15% to the healthcare sector, would it be only to pay salaries? Shouldn't it be to invest in that sector to ensure that healthcare is made available to all Nigerians?
Okay, to start with, the revenue that the Nigerian government is getting now. What we are saying is that with this revenue, can you allocate 15%? We believe it will be enough. Secondly, I talked about infrastructural development. In fact, that will even take a large chunk of the allocation, because we need to. There's no reason why Nigeria should be having just one tertiary health institution in every state. It is simply not enough. I've also argued that even if we are too bothered about this brain drain, why not increase the capacity to produce more? Because ultimately, when people go out there, it will still benefit the country. You know that diaspora remittances is one of the main sources of forest to this country. And many people that go out, they will still come back to serve their people with acquired skills and even equipment. So it will benefit everybody. Remuneration is important. Personnel, we don't even have enough personnel in the hospitals. Even though we don't have enough general, we still have doctors who are outside the system clamoring to be absorbed. That has not happened because of the bureaucracy in employment. It takes about 6 to 8 months for you to employ anybody in our hospitals.
The amount, the demand and the circumstances around this demand, they kind of like outweigh each other, so to speak. You talk about 80,000 medical doctors are registered with the Medical and Dental Council of Nigeria, right? And NMA says just about 40,000 of them are working in country as we speak. So where are the others? Between 3,000 and 3,500 we graduate every year from our universities. You talked about the fact that, okay, why should we have only one tertiary institution in each state? The question will be, as Maupe asked earlier, the revenues for government are appearing to be dwindling every year continuously. But what you're demanding 200% increase. If every other part of the country demands for that kind of increase or increase as well, how would the country stand? Is NARD also thinking about other solutions that can help government also boost this funding for the for the health sector?
Well, the truth is that we are talking about health sector, and I should think that health sector is a very important sector. And of course, which other profession are they trying to bring up a bill to forcefully restrain them from leaving their country? That should tell you something. We are not saying that we are too important or maybe we are more important than others, but I've not seen any country that wants to make progress that will not pay adequate attention to their health sector and their education sector. So, and that's what I'm here to talk about. Let government invest in health. Let them encourage even private sector investment. It is within it, that is what they are supposed to do, and that's what we are advocating. And the truth is that we have placed our demands on the table. We have worked it out. The point, the government has not come for negotiation. They have not called NARD. We wrote a letter to the Honorable Minister of Health as far back as July last year.
Sorry, you said you have worked it out, and you worked it out with possible solutions to recommend to government as well?
Of course. We have done all that. We have submitted to them severally. So all we are asking for is that let them come, because we have made an offer. What we know that if you do, this is going to help to curtail this issue we are talking about. So let them make a counter offer. Let them call for negotiation. Like I was trying to say, the letter we wrote in July last year has not been responded to. We are aware, though, that they are negotiating with ANMA, but we also heard that what government is offering is 25%. So our members are simply asking, how did you arrive at that 25%? And that was how I started off. It shouldn't just be at your, it shouldn't just be discretionary. Did they take into account the inflation rate, the fuel price increment, the exchange rate from 2009 compared to 2023? Because they are trying to address brain drain. I can tell you that if you leave it at that 25%, you've not achieved anything, because people will continue to live.
Let's bring in our colleagues from Lagos. Ayo.
Nat'l, let's begin, Doctor, by With your response to this comment from the Honorable Minister of Labour and Employment when he responded to that message that you put out?
Resident doctors are part of NMA.
All right.
They are young doctors in training. So if NMA is negotiating on their behalf as the parent body, because they have about 4 affiliates into the NMA. We have them, NARD, you have Consultant Medical Practitioners Association, MDCAN. You have also the General Medical Practitioners. You have another group. So there are about 4 affiliate bodies into the NMA. So what the young men are doing is in bad taste. And I've told their president, you are disrespecting the NMA. The NMA is our parent body. The president of NMA is #1 doctor in Nigeria. So what they are doing is that they're crying wolf when there's none. The bill in question, I don't support it. But you will not deny that legislator is right to put a private member's bill. It's not an executive bill. Even the speaker cannot stop that bill because the man is coming from a constituency. What happens in a private member's bill in National Assembly is either from your constituents that give it to you, or it's you that authored it after having a discussion with people in your constituency, and they say, this is what we think will cure this problem. But for me, that's trying to kill an ant or a fly with a sledgehammer.
2 issues raised, Doctor. One is that you are your association with this move is disrespecting the NMA. We'll come to the second one later. How do you respond?
NARD is the largest medical workforce in Nigeria, and we are the largest affiliate of NMA. Secondly, we had a meeting with the Honorable Minister of Health in January this year, where we requested that any negotiation for upward review of commerce, that they should officially invite NARD. We are not disrespecting NMA or anybody in the. All we are asking for is to be part of that negotiation. There is nothing wrong in that. It has happened severally in the past, because that is when we will be allowed to make our input. At least, even if the input we are making is not taken, we'll have something. They will give us a reason that will at least explain to our members. Now, secondly, on the bill, at least you can see that our elder, the
before you go to that
Minister of Labour,
second case, Dr. Oji, just one second. Before you go to that other case, have you had this conversation with the president of the NMA as to being a part of that conversation? As you said, that negotiation consideration, is it a conversation that has happened between your association and the NMA, or are there plans for the NARD to extricate itself from the NMA?
No, that conversation has happened, but the truth is that the government, what they normally do is when they invite NMA for such discussion, they also invite NARD, even though they will tell us that we will come with NMA. But such invitation has not happened. And it's important I go to that next point. Have you ever heard anybody from the Federal Ministry of Health condemn the bill by Honorable Ganiyu Johnson, just like our elder, Dr. Chris Ngige, just did? They have not done that. And our members have this information that it is actually the Federal Ministry of Health that may be supporting. It looks as if they are the ones supporting that honorable member to bring up that bill, because we have been in several meetings where they plan to bring up a policy statement to forcefully keep doctors in Nigeria against their wish. We were able to stop it at that level. So it looks as if because they didn't succeed in that, they are now going behind the scene to go through that honorable member to bring up this draconian bill that will end up worsening the indices we are talking about.
Well, Dr. Orji, that conversation around making a law, you know the process. It'll still go through certain points, certain levels, and the NMA, the NARD also, will have an opportunity at the public hearing to say no or to raise your issues. You don't think it's okay to step that down in the demands you're making and wait for that time if ever it gets to that, or perhaps even have a conversation with the legislator?
There is widespread condemnation of that bill. I have not seen anybody outside that honorable member publicly supporting that bill. So he is a Nigerian. He's seen the condemnation. There is no point wasting taxpayers' money to go for public hearing. You gather people to come to Abuja for a bill that is obviously defective, both in research and in statistics. Even the figures he quoted in that bill, they are all wrong.
Okay.
So there is no point doubling down on a wrong path. He should withdraw the bill and save Nigeria from this distraction.
A question that I wanted to ask you, Dr. Orji, is how profitable are health facilities? According to the minister 2 years ago, there are 40,017 in Nigeria. Most of them, about 80–90% of them, are privately owned. Now, NARD is probably speaking about public hospitals and the rest of them. So one wonders if people pay to offer services in hospitals, how profitable do you think it is? Because as Nat'l asked you the other time, if the federal government has said they have cash issues or cash flow issues, it perhaps behoves on anyone who is considering extra income or extra expenditure on behalf of government to say, these are the other ways that you can make money. Do you think there are loopholes that need to be blocked in hospitals so that they can generate enough for the hospitals themselves, or what?
Of course, the health sector is part of the Nigerian system, and you know that there have been several allegations of corruption here and there. So part of what we are demanding is that in addition to increasing the allocation to health, government should also make efforts to checkmate how these funds are being utilized to prevent corruption. And as for private sector involvement in health sector, it is the government that we encourage that they need to create an enabling environment for that to happen. But again, as long as you keep not having the numbers, even the private sector may not even have people to employ. You've heard of several times that some hospitals even advertised for residents to come in, and they didn't see anybody. So this is an emergency, and now this is actually known to step in at times like this, because we are the ones involved directly. We are the front liners. We know that we are not enough anymore, and that if government does not intervene in the right way, this will continue to worsen, and it may get to a point where we won't have doctors again. And by the way, let's be clear, it's not only doctors that are leaving the country. Nurses are leaving, and many other clinical staff. So what we are talking about is not just for us, it's for all clinical staff in the hospital. The government should increase this remuneration to the extent that people will look at it. And we are not even asking for them, we are not asking for equivalence of what is paid outside. We are just saying, pay us something that will match the economic status of the country and the cost of living. It's only when you do that people can decide to take the pains and stay back and serve their country.
Speaking of which, Dr. Orji, let me borrow from a quote from the Minister of Labour, made on another fora. He said, if the NARD, who we have been managing their matter, we're giving them everything they want, including their medical resident training fund. We are paying them, even when in training, pay them a full salary, pay them all the allowances, and you decided that we have not done enough. Like I said, you have an option to go. So it's as if the minister is saying that, look, we've given the resident doctors all that they're asking for. So I'd like you to reconcile your demands with this position expressed by the minister.
The demands we are making are very clear, and they are all in our communique. I have tried to highlight a few of them, major ones. We don't have proof that those things have been addressed? Has government been reviewed upwards? The answer is no. In fact, even in that communique, you see that we still have salary arrears of 2014, 2015, and 2016. Okay, we still have this obnoxious bill that has now been withdrawn. And the medical residence training fund for 2023 has not been paid. And again, I have to also alert Nigerians, because let's not look as if we are being treated specially. That fund we are talking about is just like every other government employee who is going for training that government is sponsoring. Government pays for the DTA, pays for the examination fee and the training fee. It's exactly the same thing they are doing for us. So there's nothing special. There's nothing special about it that they are doing to doctors. It's just that because Nigerian has agreed that we need specialists, they are now doing it in large numbers for this group of people, group of doctors who are, elected to go into specialist training. So there's nothing out of ordinary about it. But that of 2023 has not been paid. And people who have gone for exam March, April, May, we have always advocated for government to try as much as possible to pay this within the first quarter of the year, so that the people who will go for that training and that exam by March, April, May, we have the funds available to do that.
So you said earlier
that for the year has not been paid.
So you said earlier that in the conversation brokered with the NMA that government is, you hear the government is making an offer of 25%. Would that be satisfactory to the Association of Resident Doctors? And if it's not, what would be satisfactory to the association?
Our members are saying that the 25% they are hiring is not going to be enough to address the economic condition of the country. And you also know that the peculiar allowance that Mark talked about earlier, we were not affected. They didn't include us. And there is this imminent increase in the price of fuel. So if you take all this into consideration, you know that 25% will not go anywhere, and it is not going to address the issue. And we have always said this: let us be brought to the negotiation table so that we can all work together and put all the figures together using the data we have to arrive at a percentage that will be acceptable to everybody.
Let me double down, Dr. Orji, let me double down on the concern raised mildly by my colleagues in Abuja earlier on. For the Association of Resident Doctors, you have the peculiar allowance, you have the medical residency allowance, you also have the hazard allowance. That's besides, the regular monthly remuneration for resident doctors. Correct me if I'm wrong on all of these outlined allowances, but compared with other category of medical workers in Nigeria's health institutions, Nigerian doctors do enjoy this privileged list of allowances. Does this isn't this disparity rather huge, and then justify the commentary by the minister about the sense of entitlement held by doctors?
Sorry, we are not entitled to peculiar allowance. I said it earlier, they didn't pay us that. Now, all the allowances you talked about, apart from the medical residency training fund, all the allowances are part of the salary they pay us, which they pay every other health worker in the hospital. So because this is the misconception people keep having, we are doctors who work in the hospital, we render services, and at the same time we are being trained. So the salary you are paying is for the work we are doing, and that is why when we withdraw our services, the health system collapses. So, of course, you cannot say you won't pay someone who is working. Then I've also explained that the medical residency training fund is just like every other training fund they pay to any other government employee who is being sponsored for training. There's nothing absolutely special about what we are being given. We need specialists in the country, unless the government is saying they don't need specialists again, then all of us can just enroll as medical officers and start working like that. And of course, you won't have specialists, you won't have consultants to take care of specialist conditions. So there's nothing special about the treatment they are giving to us.
And lastly, Dr. Orji, Nat'l asked earlier about the register of resident doctors that you have being 80,000, but less than 40,000 are working across board. Of course, you have expressed a concern about the bill proposed by the member of the House of Representatives, but for the community of doctors in Nigeria, how concerned are you about this seeming state of emergency in the health sector with the continuous exodus of Nigerian doctors, for the health sector back home with this hugely diminishing number?
We are concerned enough to be raising this alarm. You see, people have to know that we don't call out our members on strike just as quickly as they think. We think deeply about this whole thing. We don't have the numbers again. If you go to many of the emergency department in the hospital, you don't have enough people there, and people are dying from this. People come to the hospital to see their doctors. They don't get to see them because many of them have left, and they will now turn against the few that are around and beat them up and assault them. That is also part of the reason we are having this increase in attacks on healthcare professionals. So it's affecting us the more, just like it's affecting the Nigerian people. And we have been saying this repeatedly, that the most important cause of this brain drain is poor remuneration. Nobody has disagreed with us on this. So why are you not addressing that cause? Why are you now trying to go through another means to get a bill that is an affront on the fundamental human rights of freedom of movement and choice on Nigerian doctors? It is simply not going to work.
You know, the president of the Nigerian Medical Association recently on one of our programs talked about the fact that there are many qualified doctors in Nigeria that are unemployed. But also, that there are many qualified doctors in Nigeria who would rather go into ICT, go into music, go into other forms of industry without not wanting to practice medicine that they graduated and studied for. Why is that the situation? If all these things you're asking for, that NARD's asking for, better equipment, better environment, better remuneration, do you think those doctors who've been trained to serve in the health sector would return there?
Of course, many of them, it's actually more lucrative to do other things, than being a doctor in Nigeria. And again, where it may also be about interest. Everything is not really about remuneration. We know that there are so many people that came into the profession and discovered that what they hoped for, in terms of practice, is not what they are seeing, and they simply decided to go elsewhere. So, but I know that for others, it will be about the poor remuneration that we are getting, and that is why they decided to go to other sectors.
So I'd like to know, you've given a 2-week ultimatum. What are you hoping will happen within these 2 weeks?
Our hope is that bill should be withdrawn, number one. Number two is that the Medical Residency Training Fund for 2023 should be paid. They have finished the compilation. We don't know what is delaying the payment. The third thing is that the government should discuss with us and find a way of reviewing these comments upwards to a significant amount before the expiration or before this current regime of President Muhammadu Buhari
let me get
hands over.
You are saying that the bill, which is not in the hands of the executive, it's a private member bill, should be withdrawn as part of your demands. To who now? Is it to the National Assembly or is it to the executive arm of government, who are your direct employers?
I've said before that some people are supporting him. That's why he's doubling down. So these things...
You have evidence of that?
We are going to provide it when we have negotiation. The point is that the government has not even called us for a negotiation. All we are hearing is threats. And it is not going to help anybody, because we had a hard time trying to control our members in that meeting, because you know that many of the things we listed, we have given ultimatum last year for them. So some people felt that we can actually go on a knee-jerk strike. But we felt that it wouldn't be good for the country. and they decided to give this 2 weeks, to give enough time for government to come out, because let them come and prove to us that it is not coming from the Ministry of Health. When we resolve that, I'm sure that the honorable member will withdraw the bill.
You are the one who's alleging. You say when it gets to the time, you will provide evidence that, it is the government or it is not the government. Yet you say let them come and give you evidence.
No, I didn't say that. I said at the negotiation table, we will provide the evidence. We are not going to say it on national TV.
And if you're not called to the negotiation table?
We'll get back to our members at the end of 2 weeks. In fact, we have 13 days now. 11 days now. We will get back to them and seek further directives. So anything can happen.
So essentially what you're saying is that the negotiation which the NMA is currently having with the government doesn't concern you. You want to be called separately.
We are not even sure NMA is negotiating with government. That's the point. From the information, I may be wrong, but we have tried to ask, we have been listening, because the Minister of Health promised us, as far back as January, that if there is going to be any other negotiation, apart from the one they had last year, that they will call us. They have not called us.
So that was a promise given by the Minister himself?
Yes. So there has not been negotiation on this issue this year at all. And that's why when we started hearing about 25% increment, we are wondering where it came from.
Dr. Oji, just before we let you go, there are those who will be wondering. Incidentally, you're dealing with people who also took the same oath you took. The Minister of Health, the Minister of Labour, they're all doctors again, took the same oath you took, which is an oath to save lives, to provide health services, to ensure that people are safe and healthy. Nigerians will be wondering, how much of that oath are the doctors standing by?
We are standing fully by the oath we took, and that's why I keep telling you that we are doing this for the Nigerian people. They need to understand that, because when everybody leaves, there won't be anybody to treat them. Secondly, part of that oath is also to take care of ourselves. So we shouldn't be blamed. It's actually unfortunate. Honestly, if we don't want to be threatening strike or even going on strike, if the Nigerian people on their own can elect to do this fight for us while we remain in the hospitals and work, we will simply accept it. But when nobody seems to be helping out, we have to help ourselves.
Thank you very much, Dr. Emeka Oji is the National President, Nigerian Association of Resident Doctors. He's also a Senior Registrar, Orthopedic and Trauma Surgery. Thank you for coming on this morning.
Thank you.
Sunrise Daily will be back in a moment. Do stay with us.